You know, I have an idea, Dr. Wynn. I would like to, why don't we present a case study? I would like to present a case study where conservative treatment won the day. And then I'll give you the opportunity to do the same thing. So I would like to present a case. It was a patient that I saw a few months ago, and she's an 82-year-old insulin-dependent diabetic. She takes insulin. And she so unfortunately fell at home off a bar stool, and her foot went flying and hit the counter, and her foot was dislocated. And they brought her to the emergency room. They put a plaster of Paris cast. They relocated the foot, and then they were waiting to bring her to the operating room to put hardware in to fix the fracture, because her ankle was fractured. But unfortunately, in the few days after this happened, she developed an ulcer from the cast. So she now had a wound on her foot, and the wound, you assume, is infected, and they didn't want to put the hardware in the foot because they had to wait till the wound healed up and the foot was not infected. Otherwise, the hardware would get infected. So the patient reached out to me, and what I did was I had the patient come to my office once a week, and I put her in a soft cast, and then and a special boot, and her foot was dislocated on the leg, and then I put a device inside the boot, and I slowly repositioned the foot inside the boot. So she never had to have any surgery, and the fracture did heal, and the foot did go back into the correct position. It took several months for this to happen, but the operation of choice that they wanted was an ankle fusion, which would take probably 6 months, 8 months to heal. So this is a case of using conservative treatment. The patient now has a functional ankle. She's well healed. She's now in sneakers. I just saw her last week, and she's very happy. So she has a functional foot. So that's a case of where we avoided surgery and had a better outcome.
Very good. She's definitely saved the day. That's for sure. Because with this patient who's in their 80s, and by putting the patient on complete off-weight bearing after the ankle fusion is never a good situation.
No, not with the diabetic, because the blood sugar would have been really high.
Yes. And then just not about the physical component, but the psychological component for that age. Mm-hmm. It's so important that, they're going to go through depression. Mm-hmm. They're not be able to walk. And I know so many 80s, patient in their 80s, and they're so independent. They still drive, they're still doing their things, and that's all.
Working even.
And working even, yeah, they do part-time job, and they do helping out, volunteer at the local places, organizations. So you know what, at that 80s, and put them on at least 3 months on the off-weight bearing for the ankle fusion. That's almost from the surgeon point of view, probably it's good, but then from the patient point of view, I don't think that is, it's not going to be a good solution for them. But
do you have a case study that you'd like?
Of course, I do. I have so many. Okay, so here is the case study that I want to present. Is actually, I don't think conservative will help. Okay, this patient who is 67 years old. She is a terminal cancer patient. Oh. Her oncologist gave her 6 months.
Wow.
That's 5 years ago.
Wow, okay.
So
that's good news.
So that's a good news. So she had breast cancer. It's metastasized to her spine. Oh. And her only sanity is to walk. She went to orthopedics. She went to other podiatrists, foot and ankle surgeons, and would like to address her foot problems. And actually what her foot problem is that both of her feet have the second toe cross over to the big toe. And because she loved walking so much, she just pushed through the pain and walk, and her third toe cross over and just follow suit. So all the lesser toe is kind of come in toward the big toe. Mm-hmm. And that's how she came to me for the consultation. She saw me doing minimal invasive in town. So she's called up, was like, can I just see Dr. Nguyen to see if she can help? And literally on that visit, that I said that I can do something to get you back on your feet and walking. And that's what she wanted to hear. She gave me a hug, and then we scheduled for surgery. So she has a bunion deformity, crossover toe of hammer toe. So that's something. Her doctors gave her some of those insoles that she could not tolerate because it's keep buckling over, the second toe keep buckling over the big toe. So it keep rubbing on her shoes every time she walk. After her treatment, she loved to walk so that it can ease her mind off from the treatment.
Yeah.
And that's how her coping mechanism for like aftercare, after chemo. But she's in so much pain, she developed blister inside where the bunion bump is. The hammer toe where the knuckle bone that rubbing on top of the shoes. So we actually scheduled a procedure, and we did the procedure. We got her toe straight up, and that's actually one of very beautiful case study that I have. And I be able to get her back walking the same day, and she just amazing. She had minimal pain, and I gave her the custom orthotics, so for her to walk and give her that support. And
because now they could fit in her shoe.
It fit in her
because
shoes.
her toes are sitting in the right place.
It's not rubbing anymore. And she'd be able to carry through with her walk. She would start walking 2 miles 10 days after surgery.
Wow. That's
Yes.
pretty good. I wonder if I could walk too.
Yeah, I know. Yeah, and I was like, where do you walk? I mean, like, literally. So, and she said, I feel so good. I didn't even feel that there's pain in my feet anymore. She put up for like 5 years. That
Wow,
with her,
what a great thing to cross off with the
cross
list of problems, cross off foot pain.
Foot pain, yes. And she be
That's
able
great.
to walk, and her last 4 months of her life, she's still walking, And,
She's still around?
No, she's not, unfortunately. But I think that I be able to help her, give her the solution, and transform her foot to walk with no pain. And I think that is a beautiful thing, and I still touch. And I did, for some reason, my last visit with her as a follow-up post-operatively, I record a video for testimonial. And I still have goosebumps when I talk about this.
Oh, you do? I see. You're not lying.
Yeah, so it's actually, she she's very sincere. She shared her story. And it definitely is,
good for you.
And that is something, like for you,
quite a
your
story.
case is helping this 82
Yeah.
able to avoid additional surgery or like surgery to correct.
Yeah, because it's not about, maybe
with
not
fresh
so much about quantity of life, but quality.
quality of life. Yes.
Getting around.
Yeah, and that is,
making your,
it's so important.
your
Like,
day count.
to us, we see that it just one deformity, but to patient, that is their whole world. That's their livelihood right there.
Yeah.
And I think that we give the public a very good solution to take care of their feet.
Well, Dr. Nguyen, I would like to tell you that in the beginning I was wondering about having a debate with, whether I would win or lose. And then, of course, since your name is Dr. Nguyen, I thought it was unfair because it's like I might as well be Dr. Lose. But this was very good, and I hope we help people, to think of different ways to address foot pain, whether it's conservative methods, which is orthotics, arch supports, splints, whatnot, or foot surgery.
Right,
There's different ways to handle different problems.
And I always tell publics that, any patients come to us, and I do, I be on the radio locally to educate the public about foot health, because there's so many not correct information out there, when it comes to foot pain. Foot pain is never normal. So anytime that anyone that have foot pain, or someone who have foot pain, just have your local doc check in, and there is always a solution. It's better to take care of it sooner than later. That could be like either like go through conservative option, like see Dr. Jensen's here, or myself. Like for me, even if just when a patient see me for the first time, I usually ask them what have they tried before and what's been work. And sometimes patients it just put the surgery off because of the fear and everything, and as when it's get to me,
foot pain off
completely.
They're like, oh, this
Yeah.
is normal.
Yeah.
I'll just soak my feet in a bucket of water.
And by the time I get to the patient and be able to correct, instead of just fixing their bunion, I need to fix the hammer toes and 1 toe, 2 toe, 3 toes, right? So it's going to be more work for, for you talk about the surgical approach part of it.
Okay, well, thank you very much for coming to the Jersey Shore and working on this video together.
Yep.
And I hope we helped people to think about their foot pain.
Yep. All right. Thank you, everyone. Okay.
Thank you.